The Stigma Index reflects the lived experiences of people living with HIV and the impact thereof. The research was done with the help of about 5,000 participants from the ages of 18 years and older from all 9 provinces. 63% were female. KZN had the most participants. The team was led by about 60 field workers and supervisors who faced a tough job.
It was honestly not easy because you needed to engage with various people with different understanding and beliefs.
The findings: 49% of people living with HIV and AIDS suffer from self-stigma.
A lot of people who are living with HIV are still carrying the burden of self-stigma. They still feel ashamed for having stigma. They still do not feel comfortable disclosing their status to family, to friends in professional settings. So basically, around 49% of the respondents have reported to be feeling bad or blaming themselves for having HIV. So this means that we do have a serious problem of internal stigma in South Africa.
The report also found that external stigma at the hands of healthcare workers and family discrimination is another factor. One of the recommendations: stronger government interventions and community partnerships.
We recommend that the National Department of Health and Provincial Department of Health must design some capacity building workshops that are comprehensive for healthcare workers, including our communities. I think as people living with HIV sector, we also have a responsibility to make sure that we address self-stigma by designing programs that will be implemented and led by people living with HIV. We are calling people living with HIV to collaborate with our government so that we can make sure that we reduce stigma at facility level, because stigma is one of the barriers for people living with HIV not to access essential healthcare services.
We feel this is the game changer. Especially because we know that over the decades we have been talking about stigma and discrimination reduction strategies, but for quite some time we're still not seeing the reduction. So as a department, we feel it's an opportune time to respond to it swiftly. Hence we indicated that this result should not gather the dust, because we need to actualize it.
Researchers hailed this latest report as a milestone in ensuring that the voices and lived experiences of people living with HIV remains at the center of research, advocacy and policy development. Some of the activists emphasized that stigma remains one of the biggest killers of people living with HIV and AIDS and those suffering from TB. They hope that the findings and recommendations from the index report can further strengthen the fight against stigma, in particular that related to HIV and AIDS. Patricia Fasahi, SABC News in Pretoria.